Every single dollar of your revenue cycle depends on the people working inside your EMR every single day. When those roles are filled locally, your practice is exposed to a volatile job market. These positions are difficult to fill. They take months to train, and your cash flow slows down when a desk sits empty. MGMA data shows turnover for business support staff spiked to 33.3% in 2022. Replacing just one costs between $9,000 and $12,000, split across recruitment, lost productivity, and slow onboarding. The high turnover and replacement overhead of an in-house billing team create a systemic drain on practice cash flow. For practices running Epic, this problem has a specific edge. Epic is a complex environment. You cannot point a generic data entry worker at it and expect accurate claims. A biller who knows Creo or eClinicalWorks does not automatically know Epic. They need to understand specific navigation paths, payer configurations, and how your specific specialty handles CPT codes. A new in-house Epic hire requires a 60 to 90-day training ramp to reach productivity, while you pay their full salary. Over those 90 days, error rates spike, causing mistakes that lead to denials. The operational advantage of investing in a system like Epic disappears if you cannot afford or retain the specialized talent required to operate it. Medical groups are facing a financial squeeze. 90% of practices report that operating costs are higher this year than last, driven by the rising wages of healthcare support staff. Recent industry polling confirms that medical coders and billers are now the hardest revenue cycle roles to hire. This radar chart maps the market pressure. An experienced Epic billing specialist commands up to $64,000 in base compensation. But adding payroll, taxes, benefits, and training, the true fully loaded cost hits $75,000 per year. For mid-sized practices, competing in the local talent market for credentialed Epic billers is mathematically unsustainable. The direct consequence of those empty desks and expensive learning curves is a sharp rise in claim denials. This line graph tracks Kodiak Solutions data, showing initial claim denial rates climbed to nearly 12% in 2024. Zooming out to the industry level, this pie chart shows the 41% of providers who now report denial rates above 10%. Every denied claim creates a rework loop. It requires an uncompensated staff hour to investigate. It forces a manual resubmission, and it stretches your reimbursement past the 60-day mark. A denial is more than a delayed payment. It is a permanent capacity leak in an already overwhelmed department. Many practices are bypassing the local hiring loop. They partner with Staffingly to deploy dedicated remote specialists, a model distinct from a generic shared service call center. Staffingly provides specialists with documented Epic experience who hold AAPC and AHIMA credentials. They integrate directly into your workflow. The same specialist logs into your native Epic EMR every morning, learning your payer mix and specialty coding patterns. Instead of a 90-day training ramp, Staffingly executes a 14-day go-live pilot. Your EMR access is established in 48 hours, and they work to submit clean claims on day one. Shifting to a credentialed remote team trades the hope of physical oversight for measurable operational stability. You maintain accuracy through process control. Systematic daily sampling and quality audits ensure error rates stay below the 1% threshold. This flowchart demonstrates the AI tool built into their workflow, called Smart Routing. It prioritizes time-sensitive denials first. According to Deloitte data, this automated claim scrubbing prevents up to 85% of avoidable front-end denials before they leave your system. You retain visibility. Every week, your practice receives a KPI dashboard tracking throughput, turnaround times, and accounts receivable aging. Combining human credentialed expertise with AI-augmented workflows changes the billing equation from reactive recovery to proactive prevention. Let's map the financial reality. The trade-off is the fully loaded cost of local hiring versus a dedicated outsourced seat. This chart lays out the margin gap. An in-house Epic biller costs $75,000 annually. A dedicated Staffingly seat costs roughly $20,700 a year. That represents a 64% reduction in cost. For a two-biller practice, that's nearly $70,000 in annual savings. You also gain structural agility. The engagement is month to month after the pilot. You can scale up with 30 days notice, and Staffingly can replace a team member within 48 hours without severance risk. Practices choosing this outsourced model reduce administrative overhead, reclaiming margin to reinvest directly into patient care. This solution is built for mid-size practices running Epic that need to reduce accounts receivable and prioritize clean claim rates. If your practice requires physical in-office supervision, or if you operate outside major EMR systems, this structure will not fit your workflow. For those ready to scale, security is verified across SOC 2 Type 2, HIPAA, and HITRS. The next step is a 14-day risk-free pilot. You establish EMR access and baseline protocols, evaluating performance before making a long-term commitment. Payers use AI to reject your claims faster than ever. The only effective response is a dedicated team with a workflow expertise to submit